Okay, everyone's still here, correct? Okay, so I am probably, I don't know if you can get the PowerPoint open on your computer. I'm going to have to just talk because, and my husband's in Arizona right now and he's my computer guy and he's probably not awake. So um, I'm just going to talk, unfortunately. Sorry. Um, okay, so, oh, let me get recorded here. Okay, I am recording. Okay, so I apologize. Right, I'm not going to mess with it because that might shut down my whole computer. Okay, so just realize the job of the scrotum. Sorry, my hair's kind of wild now, and really is to house the testicles. The scrotum does not move itself. It's that cremaster muscle that will raise or lower the testicles. Now on the next slide, it talks about the spermatic cords. So there is connective tissue over the testicles and the cords, but it looks like a net. If you see the picture, it looks like a net structure. And it basically has the blood supply, the nerves, the lymphatic vessels, also the vas deferens. So it's all part of these cord-like structures. And this is basically the heat exchange mechanism. So it can bring, it can dilate and bring warmer blood or constrict to cool the blood. So that can help with the temperature, but it basically brings the oxygenated blood, removes the CO2 blood, brings the lymphatic fluid, keeps them healthy. And that's in the spermatic cords, which surround the testicle. Now, there are tunics that basically, if anybody, I know some people have experience and maybe you've seen a neuter. Normally, when they go to neuter, when they incise through the skin and the muscle, there is a very dense white connective tissue like a capsule, and the doctor will cut through there and pop the testicle out. So those tunics, as the testicle moves to descend, these are like coverings or protective tunics that have to be removed prior to a castration. So there is a visceral and a parietal, and they are called the vaginal tunic. That is not a typo. Even though this is a male, they are called the vaginal tunic. But they have to be removed. And on this slide, which I'm trying to see the numbers of the slides, but my print is kind of small. These will have to be removed in an orchiectomy. Orc is always pertaining to testicle, and ectomy is removal of. So an orchiectomy is just a very fancy way to say castration. So those tunics are removed. The next slide talks about the tunica albuginea. Now the tunica albuginea is, oh, thank you for slide 15. Okay, so I might write a little note on here. Thank you. I cannot, even with these, I can't read that number. The tunica albuginea, which is the next slide, that is the tunic that's closest, that encloses the testicle itself. And that's a very fibrous capsule. Inside, in this picture, it looks like the testicle is half cut in half. So you can see like a section is removed, and you see these little string-like structures, which are actually the seminiferous tubules. In the picture, it kind of reminds me of spaghetti, but it looks kind of like a noodle. If you cut one of those open, that is where the sperm are, where the spermatocyte turns into a spermatid. So, but those septa divide those seminiferous tubules. So we've got the tunics, the visceral and the parietal, and then the innermost tunic is the tunica albuginea. So all of those are going to be cut through when we do the castration, and that's going to be removed. Now, the seminiferous tubules are actually, that is exactly where the sperm is produced. This is spermatogenesis, and if you see in this picture, they basically have kind of like a little, one of the tubules out, and then when you cut that tubule in half, you're looking at a circle. Inside that circle, you have a spermatocyte, which is a cell. A spermatid is kind of like a little tadpole. It's like a baby sperm. And you have mature spermatozoa. So it goes from a spermatocyte to a spermatid to a spermatozoa. So that's the rate of maturity. There are some things in there called Sertoli cells. Sertoli cells. Now, a Sertoli cell, it basically, the definition here is that it supports the spermatids and shield them from the immune system. So the body, they would potentially recognize the spermatid as foreign and potentially destroy. The immune system would attack the spermatid. So the Sertoli cells, kind of think of them like a shield. They're kind of putting like a barrier around these growing sperm and saying, like, don't touch them. These are part of your body. Interesting thing in men, when they talk about certain reproductive cancers in men, there's something called Sertoli cell tumors. So those cells themselves can become cancerous, and it's a form of, it's a cancer that men would get. So there's testicular cancer, there's Sertoli cell tumor that's specific to those cells. Now, in dogs, we typically talk about prostate cancer or testicular cancer. So we usually talk about that. But in people, they would define it down a little more specific to the actual type of cancer. Okay, so that's what the inside looks like. And then we have, if we move on, the next slide, so I think it's slide 18, says the epididymis. Now, this is a testicle that's been pulled out of the body for a castration. I may send you guys, I don't want to mess with trying to open up the internet right now or take time, but I'll send you some videos maybe about, of a canine castration. Feline castration is a little different than a canine, but it's basically a flat ribbon-like structure. You can see you've got the round testicle on that picture, and then you've got a band. It looks like a band, so you've got a circle, and then there's a band that comes around here, and it has a head, body, and tail. But the epididymis is where the mature sperm are stored. So when they mature in the seminiferous tubule, they're going to move to the epididymis, and they can be housed there until, breeding occurs. So that's where the mature sperm. If you look at a dog that has a thin scrotum or not a lot of fur, you could see, like on Bo, sometimes they look like they have a bump or a point on the end of the testicle, and that's actually the epididymis. And we will probably have some male cat cadavers, and if we do, we can actually take the testicles out and look at that epididymis, so we can actually find it on these cadavers. But the point of the epididymis is for the storage of that mature sperm. Now, if you look at this picture, you got the testicle that's being held in the hand for castration. Then you've got like the two bands of tissue. If you think about those tunics or a covering, if the doctor cuts them, it's like turning a sleeve inside out. So part of that is, it says the everted vaginal tunic. Everted just means it's been cut and removed and turned inside out. You've got the pampiniform plexus and the vas deferens. Remember, that's all of that is going to be resected. Basically, at the bottom of that picture is where the skin is. The doctor's going to put a clamp and put some sutures there, and then all of that will be removed. And there'll be like a little stump that's put back into the body. But that is all going to be removed. So a dog that is neutered should not be able to produce sperm. Pretty straightforward. Okay, on the next slide, which, let me see, is the vas deferens. Now, on this picture, some of the structures, the first picture I showed you that was still on my screen, I actually can't get it pulled back up, but basically the vas deferens is the tube that comes down from the testicles. It attaches to the epididymis. So the epididymis has the mature sperm. The epididymis is going to connect to the vas deferens, and the vas deferens is going to go back up into the body, and it connects to the neck of the bladder. So the vas deferens is the tube that's going to carry mature spermatozoa to the urethra when it's time for them to breed. So it moves them. Now, one very important terminology to understand. If we talk about spermatozoa, all we are talking about is the sperm itself, just the sperm. If we're talking about the semen, when the spermatozoa enter the neck of the urethra, or right at the neck of the bladder, it's going to mix with secretions and create semen. So there's two separate things we're going to be talking about. Now on slide 20, excuse me one second. Okay, sorry. So on slide 20, remember the urethra has both urinary and reproductive functions. If you look at this picture, it basically shows you've got the bladder and the ureters that are coming down from the kidney. Then you've got these two vas deferens. They come around the ureters and join the bladder. Now, you have this circle here called the prostate, and then we've got the urethra and the penis. So I want to go to the next slide, which is 21, and talk about what are called the accessory reproductive glands. Now, these glands have ducts and they join at the urethra, but the accessory glands produce the seminal fluid. Now, you don't have to know these pictures. In the species, they are different. Not every species has every accessory gland. All I want you to know for the test is that the accessory glands produce the seminal fluid. So basically on slide 22, which should be the accessory reproductive glands, it produces an alkaline fluid. You need to know that it is alkaline. The female reproductive tract is acidic. The female is doing everything she can to not get pregnant. So it makes it difficult. So the male makes the fluid alkaline. So when it meets the acidic environment of the female, it acts as a buffer to help the sperm survive. Now, what you're going to do when you put an alkaline fluid in an acidic environment, hopefully you get closer to base and the sperm will survive. One of the things, like I told you, when we assess a male for breeding and we will get a semen sample, now we're obviously going to be looking at the sperm to make sure the sperm are healthy and normal. But the other thing that we're going to do is we're going to check the pH of the seminal fluid, because if the pH isn't alkaline, say it's acidic, Is it mixing with urine? Which urine isn't typically acidic, but if the accessory glands aren't producing the proper fluid and it kills the sperm, the female isn't going to get pregnant. So pH, you need to know that it is an alkaline pH. If you tell me base pH, basic, it's wrong. If you tell me acidic, it's wrong. It's an alkaline fluid to protect the sperm. Some stuff that is in the seminal fluid, there are electrolytes, there are fructose. Now, the sperm are going to live off the fructose, which is like a sugar. The electrolytes are going to give the sperm energy. And the prostaglandins, remember, prostaglandins are tissue hormones, and they're going to help protect the sperm against inflammation. So the prostaglandins are protective. The fructose is nutrition. The electrolytes are nutrition. So that is what the seminal fluid should be. Should be nutrition and protective for the sperm. What I want to mention, and well, let me see. I might be able to go back to this slide. Let me try something. Can you guys see this? Can you guys see this picture on my page? This, okay, I can't make it bigger, unfortunately, but let me explain something about the accessory glands, okay? In the male dog, so I got this, do you see that little rainbow circle? It's like my bane of existence right now. I don't know why that's happening. But here's the prostate gland, okay? That is one of the accessory sex glands. You also have down here, we've got the bulb of glands, but we want to talk about the prostate gland, and not on this picture is the accessory sex glands, or one of the accessory sex glands. The prostate is going to make that seminal fluid. So when the sperm come up from the vas deferens and they join at the neck of the bladder, the prostate is going to add to the spermatozoa this fluid. So what comes out of the urethra is sperm mixed with the seminal fluid, which equals semen. One thing that I want to mention, because I think understanding the anatomy of where the prostate is can understand, like when dogs have prostate cancer, it's one of the things we radiated for, because the prostate is under the pelvis. The pelvic bone is right here. If you see that little white, right above my little rainbow circle, that is a bone. When a dog has swelling of the prostate, like prostatitis, is inflammation or prostate cancer, the problem is we can't just go in and operate, because we would have to crack the pelvis to get access. During dissection, we can't find the prostate because it is underneath that pelvis, okay? When an animal gets a swelling there or cancer, it can potentially close down on the urethra. One of the #1 clinical signs of a dog with either prostatitis or prostate cancer is that they are dribbling or straining to urinate. It is because it's strangling the urethra. I had a dog that we radiated. We didn't do a lot of emergency radiation, but a beagle came in, it basically almost could not pee. And this dog could almost not poop because above the rectum, there's abdominal lymph nodes, and the cancer had spread to the lymph nodes. So the lymph nodes were pushing down on the rectum. The prostate was pushing up. They were basically pancaking the rectum. I went to do a rectal on this dog because my boss, I always had to check every day to see what it was. I could only get about the very tip of my finger. Most dogs, if you do a rectal, you should be able to get up to this knuckle. I could get about that much of my finger in. And when the dog defecated, it's called ribbon-like stool, because when they defecate, the rectum or the colon is compressed and the poop comes out flat. So one of the two things I always ask owners if I suspect it's a prostate issue is, can they urinate? Is it dribbling? can they defecate, and what is the shape of their stool? Because that's going to tell us a lot. And it's because of anatomy. If the prostate, and that's why there's no more men in this class, because unfortunately Jonathan left, but if men go to a doctor and they have to turn and cough to check a man's prostate, they have to go in rectally, because when you go in rectally, you can feel the prostate. In a large animal, if you were to do a prostate exam on like a bull or a stallion, you're going in with your whole arm in the rectum or the colon, and then you reach in and you can feel to see, is it bilaterally symmetrical, meaning is it the same size? Do you feel swellings? Do you feel a bump? So that's how you check the prostate. I worked with an emergency doctor who was fantastic, and he said there's only 2 reasons an animal should not have a rectal exam. No rectum, no finger. Everybody has a rectum, everybody has a finger. So what he would try to say is that every animal should have a rectal exam, because you can check these structures. So basically, the job of these accessory glands is to produce that fluid. If we have problems with these glands, again, it can affect urination. We did radiation twice in one day, which we normally don't do, but we could space it like 8 hours apart. So we got this dog first thing in the morning, radiated it, and stayed late that night till about 8 p.m. And we did a second radiation dose. And it did shrink we couldn't get it to go away completely, but the dog was able to urinate a little bit better. Not 100% normal, but the dog was more comfortable. So does anyone have any questions about? You talk about reproductive diseases in ClinMed 4, but understanding these diseases is understanding the anatomy of where do you find these structures. Okay, so I just want you to know the accessory glands, they have seminal vesicles, prostate gland, bulbourethral glands. Okay, in the male, if you look on the picture, you can see where you have the prostate gland. They do not have bulbourethral glands. So not every, if you open this PowerPoint on your computer, I can't get to this slide, but it'll tell you which reproductive tract those are from and what is set. But again, they make seminal fluid. It has electrolytes, prostaglandins, fructose, and basically they're essential to make this fluid for the sperm to survive. Now, the penis itself, the breeding organ, and it has muscle, blood supply. It obviously has erectile tissue. Now, the amount of erectile tissue per species is very different. Like a stallion, for example, has a very large amount of erectile tissue. A bull doesn't have as much. So when a bull extrudes his penis, there's not as much erectile tissue, very different from a stallion. So sometimes people, they see a horse urinating out in the pasture, and people like to make comments like, oh my gosh. And it's like, yes, they have a larger amount of erectile tissue. Now, a male dog is going to get engorged, but not to the degree like a stallion would. And a male cat, they actually have barbs on their penis. If we have a male cat, we usually do for dissection, we can dissect down and you can actually feel and sometimes see the little barbs. They help induce ovulation in the female, and we'll talk about that. So the urethra runs down the center of the penis. Slide 23, there is the body and the root. Now, I can't get to the picture, so I just said 22, 23. Slide 24, I want to mention it's on the 5th page, the 5th whole page, 6 pages of, well, it's my 5th page because I print 6 slides per page. But slide 24 talks about the penis, and there is a glans on the end. See, do you see where it says bulb of glands? It has a lot of sensory nerves here. But what the bulb of glands does, and actually on slide 25, it explains it better. If you talk about the bulbs of glands, when a male dog mounts a female, that bulb will swell and they form something called the copulatory tie. I might, let me see if I can. Okay, can everybody see this Google picture? Let me see. Okay, I just made that full screen. Okay, so what's going on here when a male mates and mounts a female? The male's going to mount typically from behind, and that glands is going to swell, and they're going to be tied together. They could be tied together for 2 minutes up to 30 minutes because that bulb has to decrease in size for the male to be able to be removed. If you look at these pictures, it says, why do dogs get stuck? Some of these dogs in here look like they're going the other way. And what's happening is the male is still not relaxed. So it helps ensure breeding. It's just one thing that can happen. Interestingly enough, we had a lady call the ER. I got on the phone with her and she was freaking out because she was like, there's a male on my female, and she was in heat, but she had a fence and she swore no dog could get to her female. And she goes back there and she's like, he won't get off my female. And she's trying to pull the male dog off the female or her female. And I'm like, ma'am, stop. Because first of all, you probably don't care about the male, but you could damage your female dog if you try to pull and that gland is swollen. And by the time she went back in the house, because we were like, you can throw some water on them, or sometimes you can do something to snap them out of it. Most of the time, I'm like, you just gotta let it go. And unfortunately, I'm like, probably a grandma now because it doesn't take much, it doesn't take long. And by the time she had gone back outside, the male was gone. So it had calmed down. Sometimes you guys will notice in the kennel, because we get a lot of male dogs in that need to be neutered from the shelter. And sometimes people are, and you may even see this on your personal dogs. My Beau has done this occasionally. They're on their back and you'll see the penis. There's like a band of firm tissue and you see the testicles and you'll see a swelling there. If they get excited, and it could just be happy, I'm not meaning that excited, but they are just happy to see people, or they might catch the scent. In our kennel, we have males and females. If one is in heat, it could be getting them excited. But we had one kennel dog that every time someone went to go take him for a walk, he kind of humped their leg and he would get excited. But you might see that swelling and it'll go down. Clients may call you and be like, my dog has this swelling. Interestingly enough, I was an on-job trained tech before I went to school. And my boss told me to get a urine sample on a dog that had been dribbling urine. And I take him in the back and I have to roll him over and I have to pull out the penis and I have to pass the catheter. But when I went to pull out the penis and roll him over to do this, I see a swelling. And I go to my boss and I'm like, hey, I know why this guy can't pee. I figured out the problem. He's got like a tumor or a bump here. And my boss had to say, he goes, Christine, he's just really happy that he's seeing you, and this is this gland, and in about 5 minutes we recheck it and it's completely gone. And I was fairly mortified. I learned something, but I hadn't been to school yet, so I just see a big bump by his penis, and the dog had been dribbling, so I was kind of like trying to put two and two together. That swelling is normal. It should go away. Sometimes it will cause the penis to come out a little bit. There's been sometimes Bo goes outside, he gets really excited or he's sniffing something and I can see a little bit of his penis sticking out of the prepuce because there's a covering that should be there to protect it. It should go back, and they cannot have their penis out. It's called priapism. If a dog gets overly excited and the penis comes out, the penis is a mucous membrane tissue, and it's very prone to drying out if it stays out for an extended period of time. So if it gets too swollen, we would have to see the dog. Sometimes we can apply sugar, sedate them, lubricate it, put it back in, and we can do that. We had a little Yorkie that had a special bear, and the owner just could not get this dog to stop humping the bear. And when he came in, it was very swollen and irritated, so we had to sedate him, clean it. We put the sugar, when I'm talking just sugar, like from your kitchen, we mix it with some saline, we make it into kind of like a sugar paste, and we rubbed it, and it takes the fluid out of the tissue, so it brings swelling down. Then we lubricate it, put it back in, and we put 2 little stitches in the prepuce to hold it in so that it could get remoisturized and not dry out any further. And we said, number 1, get your dog neutered, and number 2, get rid of the bear. So anywho, that's kind of what we're dealing with here. So if you see them like this in these various positions, here is kind of, maybe if you guys could see this picture, here is some better anatomical pictures, but the gland is here on the end. Now here's the prepuce, which is the skin that should cover that. When this comes out, it basically, that's what's going to form the tie. And you can see in this picture better, the urinary bladder is here. There's the ureter. This is the vas deferens coming in, and there's the prostate. Here's the colon and the rectum. Okay. And when I was talking about the dog with cancer before, there were lymph nodes up here that were very enlarged because the cancer had spread to the local lymph node. And basically this was pushing up and these were pushing down and causing that colon to be flat. Here's another picture kind of showing some of how, this is arranged. And on your slide, it talks about the canine penis. The equine penis, which is slide 26, has a very different shape. And they have that little, if you look at the tip of it, there is a mushroom shape here at the tip, which is the glands, and there is a fossa. Remember, a fossa is a depression. If anybody's worked in a stable or had horses, sometimes they need their sheath cleaned, because the problem is what happens is a horse is out in a pasture, the penis extends, it hangs out for a little bit, there's dust and debris, and then what happens is they retract that penis, so when it goes back in, it goes back into this fossa, and it basically can trap dust and dirt, and sometimes horses have to have their sheath cleaned. So you put on gloves, you reach up in there and flush it and clean it and get out any debris. Just another fun part of equine, and that's the difference. And then, we're almost done here, but basically there is it's like, let me see if I can find a better picture. In this picture up here it says the penis retractor muscle. So normally when it's retracted, the muscle is constricting because it's pulling the penis in. When that muscle relaxes during breeding, it allows the muscle to pull out. So if you look on slide 27, the sigmoid flexure, the penis is an S shape internally, and then when it's extruded, that muscle relaxes and it lets the penis come out during breeding, and then it'll retract back in the body. So that is, you know, and then for the male reproductive functions, erection and ejaculation for breeding. Okay, so that's all for the male today. I'm sorry, I'm going to try to get with somebody to figure out why my PowerPoint doesn't, I'm really sorry. I thought the rebooting and it was fine for later in the afternoon. So I will figure that out, hopefully. So the question, it's not, it should always be pink, Sean. So sometimes, depending on the pressure on the penis, the tip can look whitish yellow, because if the skin or the prepuce is compressing on the penis, then it would be, I have seen the tip look whitish at times. But if they were relaxed, as long as it goes back to pink, and you can always pull back the prepuce and look at the tip. But you know, like Bose, when he does it, normally looks a little more dark pink to red. As long as it's not bleeding, if it's pink to red, that's normal. As long as, you know, we look for discharge. Now, male dogs that are intact always tend to have a little bit of discharge on their prepuce. The puppy has a little bit of fur, and sometimes he's got a little bit of discharge there. As long as it's not too much and it's affecting their urination, then it should be fine. Okay. Are there any other questions? Yep. Yeah, a lot of people, when they start doing kennel, the males just are like, woohoo, we are very happy someone's with us. It happens. They had one dog, and again, there's some interesting pictures on here today. I'm sure my son is in the other room going, what is mom talking about? Because he's walked by several times. So yes. Well, tomorrow we'll talk about the female side of things. You got the homework. It's due Tuesday. Final will be Wednesday. Plan on dissection Thursday afternoon. As of right now, if there's any issues with any of that, email me. We have the meeting, and what did I say we were going to talk about? The schedule and the last day of term. So I'll make sure that stuff gets talked about. All right, you guys have a great day. I will get this video converted, and I will try to fix Word or blow up my computer. All right, have a good day.